one thing that's been, as a researcher, it's very exciting, but sometimes disheartening. But the being able to bring in now the power of what we call multivariate statistics, and using these other kinds of tools like geographic tools to tell a more complex, more comprehensive story. And maybe we could talk. I mean, one of the ways that we connected was some research that you and I did, and hope to are planning replicating to see what happens now, but where we looked at all kinds of census data and all kinds of pollution sources across the state to see how they keep gel together, or what impact, and then the impacts on a number of different like middle-aged bladder cancers, and asthma rates, and low birth weight, and
Lead.
well, lead later on, which you picked up on big time. But do you want to say how that works? That those stories and something where you can get one set of data, and then it can tell how it hits, and then how they both interact directly and indirectly to tell a more complete story, and what that story we're saying about things like asthma and cancers and low birth weight that we compelling.
Yeah, when you're bringing in various variables to analyze, you really need a model to work from.
Mm-hmm.
And the basic model for environmental justice had been looking at the influence of race and income on the siting, on the sources of pollution. This is basically what we would call a multiple regression setup, and by looking at how race correlates with the siting, how income correlates with the siting, and how race and income correlate with each other, then you can come up with a statistic that says, is there really an influence? And the we would see with our model, we would say that race influences income, and that both income and race influence the siting. So race has a double influence, one indirectly through income and one on by itself. And the statistical analysis does that. It gives us figures, numbers for each one of those paths, for race directly to the bad, race directly to the income directly to the bad, and the indirect route from race through income to the bad. And this is what we worked on with several different pollution sources. I'd already mentioned the Act 307 sites, the TRI sites, the LUS sites, hazardous waste facilities, landfills, and incinerators. So we had 6 different sources of pollution that we could work with. One of the things that we did was to develop the second study that we did, we developed an index of how many of these bads were there per square mile in a zip code, which became one of our a collective variable. Then we also had the income data. We also had other data on racial distributions, not just African American, but we also had Latino. We also had American Indian, and we had Asian, and did the analyses separately for the different racial groups. And income, we also used a ratio of renters to owners, and we also used amount of time, the average amount of time commuting from the home to one's work. So it was really a multivariate situation. The one problem with multivariate situations like this is that we need a unit of analysis, a way of collecting this information, so that for whatever, ours was a zip code. So for a zip code, we needed to know, how many Act 307 sites there were, how much incineration there was, how many LUS sites there were, what was the median income, what was the racial distribution, what was the renters to owners value, what was the average number of miles to work. We needed all that information for the one unit. And zip code was the one unit that was available for us from all the different sources that we were getting.
And there's also, when we brought in public health data, that was
Yeah. All right. Well, we brought in the public health data. That was also by zip code, but there was a little hooker with that. We could only use zip codes that had a population size of at least 5,000, and this is for privacy issues. That if with a site smaller than that, less than the 5,000, if somebody had the data and they were really, really, really interested, they might be able to come back and find out who those people were who were in the who made up the say the cancers or whatever. So anyway, we were limited. So that cut down from 873 zip codes down to a little less than 500 zip codes that we could use in our study.
But you still had over 95% of the population of the state that was included in those.
That's right. The smaller zip codes, like in the Upper Peninsula, were basically excluded, and some codes in the middle of the state were excluded because there were just not enough people.
I want to say for those who are reading the study that Elaine and I did or was published, if you are not familiar with statistics, don't worry, don't get too fretted about it. You look at maybe the first part, the conclusion, you can maybe look at some of the tables, but basically it's a way, all we're doing is a different way of telling a story. I'd like to add one thing which maybe brings up to Elaine's current work and why we are here at the Detroit Incinerator. When you looked at the different pollution, the forms of pollution, that the airborne stuff was not only the closest correlation between being minority and being poor, but it also has the deepest direct impacts of all the pollution sources. If you look at landfills having almost no impact, airborne stuff such as from incinerators were incredibly noxious, seems to be having noxious impacts or a noxious, let's say, correlation with high rates of asthma, with high lead levels in children, with cancers and low birth weight, which brings us, and Elaine can tell now, why we're here at the Detroit Incinerator and what you can tell what's going on now, some of the research you're doing with Head Start.
The School of Social Work at Michigan and the Environmental Justice Group from the School of Natural Resources and Environment were working together on a study with Head Start students. The Environmental Justice Crew, we were a little latecomers to the data. The data had already been collected on the children. These were Detroit Head Start pupils. We got permission from the Institutional Review Board to include some of that data, link that with our environmental data. What we knew from these children, this was back in the early 2000, was where they lived, what their blood level was when it was tested when they became Head Start students, and so they were 3 and 4 year olds that we're working with. One of the nice things about it too, it was that we were be holding race and income constant, because being a minority and being a low income were two of the requirements for being a Head Start child anyway. So we were going to be able to hold those constant, and we wanted to look at how close kids lived to the disamenities and the relationship with their health outcomes. So in the database that was given to me, now at my point it's secondary data, but it was originally not secondary data. I had on the children those variables, and then with the mapping program, I was able to locate where there were 36, and I made it down to 35 locations of polluters from the Act 307, from TRI, and from incinerator records that were responsible for putting lead out into the environment. So I was going to concentrate on lead and map them out. The biggest contributor to the lead in the environment is right there behind us. And so one of the things we looked at then was the children from the Head Start data. How many of them lived within 5 miles of the incinerator? About half of them did. It was 48-point-something% of the children are in the Head Start back in those days were within 5 miles of that. And 5 miles is some of the literature that's using health data tends to group the distances into 1 mile, 2 mile, 3 mile, and stop at 5 miles. So the 5 mile was the cutoff that I used there too. So we were using the GIS methods, and then
GIS stands for Geographic Information Systems.
Geographic Information Systems, yes. We were able to, well, actually, we did this kind of two ways. Working with the map person at the University of Michigan, we were able to, we looked at these 35 places and how close they were using very high-powered tools. Our ArcView and a few other, one other program that he had that was a very, very strong graphic analysis package. To look at the clusters of these. Of course, you could eyeball the clusters too, but so he was getting exact distances by measuring by using the latitude and longitudes of these places and triangulating, and he could find out the exact distance between the addresses of the disamenities. Then I did the same thing with Google Maps, getting the walking distance between these places, and then correlating to see what happens. One of the things that we discovered was that the two correlate almost perfectly. However, they're off by about a mile. So with the walking distance, you use a convoluted path between hither and yon. But this is very useful then for when we get back to people doing community-based research and participant observer research who don't have the high-powered tools. They might be able to use then things like a Google Map, knowing that there's going to be a bias, but a statistical bias is not bad like a cultural bias. Because a statistical bias, you can control for it statistically. You can remove it. Because a bias has this definite amount, and you just reduce everything by that amount. So anyway, then using the Google Maps, the distances between the little kids and their homes and the incinerator were calculated. And one of the things that we discovered is that the blood lead level of the children who live within 5 miles of that is significantly higher than the blood lead level of the children who are beyond the 5 miles. There were a lot of children beyond also had high blood levels, but they're living closer to other, this was only one of my 35 places. They're living closer to some of the others. But as I mentioned earlier, that in the same area, there are 3 other places that were make a cluster with the incinerator that are all putting out lead. So this is the highest lead producing area into the environment in the Wayne County
So from
area.
a health standpoint, what does it matter if children have high lead levels or not, these little kids? What does it matter to the quality of their life and going forward?
Well, unfortunately, it's not something, once a kid has the high blood level, the damage is done. That it affects their intellectual prowess. There are some studies that show that there's a high correlation between lead and violence in teenagers. It just leads to a very poor quality of life. I'm working with the children and getting their exact distances, which is really kind of a neat thing, because when we're working with zip codes, zip codes can be like 1 square mile, it can be like 20 square miles, because this is something devised for the post office's benefit, not for researchers' benefit. And something like this, like for example, this is in zip code 48211, and it's very close in the zip code maps to 48207. So when we're looking at what's in the aggregate data for the zip code level, people who live in 207 aren't being incorporated on that same line of data that the incinerator is, but they're in another zip code. But they're probably closer than some of the people who live north of here.